walking and cycling under the supervision of Professor Charlie Foster. His favorite physical activities are table tennis, dog walking, and operating canal walks. And he seems to have at narrowboat_Paul, which is some type of social media type communication mechanism, I assume. All right, over to you, Paul.
Well, thank you very much, Elaine. Do I need to share my screen so you can see my slides?
If that's easier, Paul, that's probably best.
Yeah, so the button for sharing is currently frozen. I don't know if it needs to be unlocked at your end.
Try it again.
Yeah, it's just showing up as frozen at the moment. So I don't know if there's a way.
I can pull yours up here and then just tell me to advance if you want.
Okay, so would you like me to just start talking and give you the nod when to move forward?
Yes, please.
Okay. Well, hello everybody. Thanks for the invitation to speak to you today. It's a real pleasure. Apologies I couldn't travel over to join you in Nova Scotia. It's the last week of semester here in Edinburgh, so it's reasonably hectic at the university. But I do have a very large fond spot for Canada. My wife is from Victoria, so we're over quite a bit, and hopefully I'll have an opportunity to visit Nova Scotia in due course. Elaine and I have known each other for a couple of years, as she said, and she's asked me to talk a little bit today about walking, physical activity, and the experience we've had in Scotland, and hopefully that might spark some ideas or some suggestions of what you guys might be able to implement to increase population walking in Nova Scotia. So if we go to the next slide. I'm speaking to you from Scotland. For those who don't know, we're the top part of the UK, population of just under 5.5 million, of which almost 1 million live in rural areas. Most people in Scotland live in what we call the central belt. So this is the kind of joined up bit between Glasgow and Edinburgh, our two main cities. And at the current time of speaking to you, we are also a member of the European Union. If we go to the next couple of slides, or we'll just a little circle there around Scotland. The next slide, I'm speaking to you from Edinburgh. That's the capital of Scotland, almost 500,000 people. It's a very lovely city. If you go to the next slide, we've got a nice picture. Please come and join us or visit us in Edinburgh if you ever get the chance. The next slide shows myself and my best friend Steve Munro on a walk in Edinburgh. It does get a little bit cold here, not as cold as I think you guys might get it on your side. That's Arthur's Seat in the background, looking north across the castle. But it's a lovely city and very walkable. In fact, I believe it's one of the most walkable in Scotland due to the kind of the land use and the way the buildings are designed. You go to the next slide. I'm a member of the Physical Activity for Health Research Centre, also known as PARC. This was us on our away day. Those are the Kelpies in the background, and we practice what we preach. So that was a yoga break about halfway through our summer picnic. The next slide tells you what we actually do in our research centre. So we're led by Professor Ninette Moutry. We have a number of key research themes, but promotion of walking, as you can see, pride of place at the top, is the majority of the research we try to do is aimed at that goal. The next slide shows you that we sort of practice what we preach. That's Ninette and I having a very serious business meeting over our work table tennis setup. And we have standing meetings, walking meetings, we play table tennis, and we try to build physical activity or movement into our day. And that's quite important. I'll touch on that later. We aren't about sports or lycra or gyms. It's about finding ways to move in a healthy and enjoyable way throughout the day. Next slide is a picture of me and just tells you that a bit about my research interests, which are primarily on walking and cycling. Very interested in how we measure those behaviors and how we use that knowledge to evaluate interventions. You know, did they work? Did walking and cycling increase as a result of what we did? Through my research, done various things, advising Scottish government, New Zealand, Irish governments on that sort of thing. And also, if you go to the next slide, it's introduced me to an organisation called Paths for All. We're going to hear a little bit more about in Rona's talk. Paths for All, Scotland's national walking charity, and I've become a director there with a kind of remit to advise on the up-to-date research and also monitoring and evaluation strategy for all of the things going on across Scotland. Next slide, just a little sample of some of the work that Paths for All does, but it's to illustrate that it's a partnership organisation, in this case working with mental health charities, because the mental health benefits of walking are some of the things that I'm most interested in. The next slide, almost finished talking about myself. This is a recent piece we did, and again, this kind of illustrates the sort of work we try to do. So this was a report released yesterday for Ramblers Scotland, who are another walking charity, but a national charity across the whole UK. There's branches everywhere. And this was a kind of very much a practice-facing piece we did to look at barriers and facilitators of recreational walking. So not for journals, not academic, but something hopefully that will be useful to direct strategy within national organisations. So I think we can flick forward now. Yeah, just the recommendations. And then the next slide is the outline of today's talk. So these are kind of the challenges that Elaine set me to speak to you guys about today. Have walking and physical activity rates in Scotland changed? If they did, who did they impact? Can we relate that to any policy change that we've seen in Scotland? And then to say, well, why do we look at walking, and are there any key messages that Nova Scotia might be able to consider as you move your agenda forward at your end? So I'll do my best to speak about those in the coming minutes. Firstly, have walking levels actually changed? Well, if we move to the next slide, the answer is yes, they have. So this is the Scottish Household Survey. It's a big, nationally representative, very well conducted, scientifically rigorous survey, and it's shown that overall physical activity, the top line, has increased a bit. That's largely driven by an increase in walking between 2007 and 2018 from 56% to 68%, while other activity has stayed largely flat. So it does appear from the independently collected data that the increases we're seeing in physical activity have been driven by an increase in walking, and it just so happens that the question they've asked there is, or rather what they've showed there, is the percentage of people who participate in a 30-minute walk at least once in the last 4 weeks. And I'll speak about this in a second, but the way that question is asked is important, but this is the way that one of the ways that Scottish Government monitors these things. If you move to the next slide, something that Elaine asked us or challenged us on is, well, is that really what's happened? Do we agree? So Tessa Strain, who's one of my kind of colleagues, but who helped me put this presentation together, actually did some additional analysis just for this talk. And so caveat, these are unpublished and probably shouldn't be shared, but having a look at another survey, the Scottish Health Survey, if we go to the next slide, we can see that if we ask the question slightly differently, what percentage report walking for at least 10 minutes in the last 4 weeks, we're seeing a sort of similar pattern where over that period of time, roughly 2007 to the present day, a steady incline. And obviously the numbers are slightly different here because of the way the question's asked and the way the data are cut, but the important thing is the lines do appear to be going up. If we move to the next slide, and this is kind of Elaine's second question was, well, who was impacted? And if we move forward again, what Tessa has shown is that if you just pick two of those time points, 2008 to 2017, men increased, women increased, but there was a larger increase in the younger ages in comparison to the older ages. Beyond that, there are actually very few characteristics available in this data set to look at. So something Elaine has asked about and is clearly a priority many places, none more so here than in Scotland, is the impact on inequalities. And that's something that we can't actually speak to from these nationally representative data at the moment, but is definitely something that we want to know more about. In terms of the disparity by age, you could look at that two ways. You could say we're struggling to get the older people to change as much, which could be a negative, or you could say it's really good news that younger people are more active now because we know that behavior tracks into adulthood, and that we would likely see the fruits of those increases, in 10, 20 years time. So you could see it as a positive. I'm not going to give, I'm not going to say it's one way or another, but there are just different ways of looking at changes like that. If we move to the next slide, Tessa was able to also cut it by region in Scotland, and you can see that there are some places where it's almost double the effect. Glasgow seeing an increase of 16% compared to 5% in South Lanarkshire. So some big variability there, but importantly nowhere where it's going down. So some places doing better than others, but going up in all locations. Something that to factor in when you're in Scotland, and I think this is a relevant question in Nova Scotia as well, is is it differential by, for example, rural regions compared to semi-rural compared to built-up? If we move forward to the next bit, and this was really interesting. So Elaine asked me, well, what was the policy change that impacted this? Because the Scottish walking strategy came in 2013, 2014. Thank you, Rona, who wrote it. And what you can see is the lines were already going up before then. So the question is, can we say that the walking strategy has had any effect? Well, we sort of went back and we spoke to some colleagues from across the academia, practice and policy to try and pull together a picture of relevant policy since 1991. Pick that date. We could have gone further back, but we had to pick it somewhere. And we can see in that period, 91 to 2000, there are some really critical early steps. So that's the kind of establishment of Scottish national heritage, which has been a really key player ever since. A national walking campaign in 94, 95, that was on media, not social media, then it was on TV and radio. Big funding, National Health Service funded that. And then crucially, Paths for All, the organisation that Rona and I are involved with, founded in 1996. And the next slide, the period 2001 to 2010, we had some important stuff as well. We had a government task force in 2000, the first physical activity coordinator, government coordinator appointed in 2002, the Land Reform Act in 2003, which is better known in Scotland for its right to roam legislation that came in a bit later, but that 2005 for that legislation, which meant within reason, walkers in Scotland can go, wherever they want. Obviously there's rules around livestock and golf courses and things like that, but it's a really important piece of legislation that isn't present in England. Then 2008, our second coordinator, and then 2010, and this is interesting, Ramblers Scotland recognises a national governing body for walking, but noting that in that walking seen as a sport, so not something necessarily that we would see it as ourselves, but certainly important to get that national recognition and to get that kind of footing nationally. We move forward to 2011, 2015, some other really interesting things. Physical activity made a government national indicator, so something that they're going to track their policy progress against. We had our first physical activity champion, Dr. Andrew Murray, whose job it was to try and get research policy. The National Strategic Group was formed in 2013. We had a physical activity implementation plan in 2014, which included walking. I've written ASAP there. That stands for the Active Scotland's Outcome Framework. I'm going to touch on that again in a second. We had the National Walking Strategy that came in. I've got the date there wrong. Written in 2013, released in 2014. But clearly, I think the point is so much had happened before then, to get us to the point where we could write and publish a national walking strategy. The Commonwealth Games in 2014. I know you had a Commonwealth Games in Canada previously, and a Winter Olympics. I personally am skeptical of the importance or the role of national sport, mega sporting events to promote physical activity. But there are people, respected people here in Scotland who firmly believe that the back of that allowed us to leverage and release more funding to promote physical activity as a whole. And I'm certainly not in a position to tell them that that isn't the case. National Vision for Active Travel 2014, and then moving forward to kind of the last slide of the story, big news in 2017 when our active travel budget got doubled to 80 million pounds, and that crucially came from transport rather from health. It was maintained in 2018, which was really good news. It wasn't a one-off. And then our Active Nation Commissioner, Lee Craigie, appointed, whose job it is to travel the country, advocating for physical activity, talking to politicians, talking to the population, and really putting the good news story for walking and cycling out there. Not to be ignored, but most recently, the climate emergency, which was declared by Scottish Government in 2019, is a really key thing that again means we can talk about promoting walking and cycling, not just from the health benefits, but from the climate benefits as well. So if we move forward and go back to that slide, you can see that if we click to the first animation, which is the National Physical Activity Strategy, that came long before the second arrow coming in, the National Physical Activity Champion, and then the next arrow coming in, the National Walking Strategy, and then finally the active travel funding doubled. It was we hadn't done this until Elaine challenged us to do it, but it's clear that there is no single key policy decision or indeed piece of policy to which you could say that's the reason why walking has increased. And indeed, if you go to the next slide and then click through the animations, while we don't have the data going back to 1992, you can see there's been a whole series, a whole policy journey that's got us to the point where we're seeing this, year-on-year increase in walking. And yet you can go forward to the next slide, because of course, the point we want to make is it's great that physical activity and walking have been increasing here in Scotland, but we aren't sitting here boasting saying the job's done or it's all finished. Indeed, we hope that while the National Walking Strategy can't be pinned as the reason that walking was already increasing, but that we'll see this red line going up on the next animation as a result. So we see it as part of a journey, it's a process, and actually putting together this talk has been very helpful for us reflectively to see how much has gone into it. And indeed, this is an important point as well, how much institutional memory remains here. What we don't have is, people moved on 30 years ago and we don't know what happened. We've got really good people across practice, policy, and academia who know this story and have been working together for many years. And I think that's a critical reason why the line's going up and not stagnating or going down. Moving forward, just to pull out some of the key ones, the Scottish Physical Activity Strategy in 2003 was praised by the WHO. It really was world leading, and I think any government or be that national or federal or provincial, I think a physical activity strategy is a critical thing to say that this is legitimate and that it's worth getting behind. The walking strategy on the next slide, any questions on that, definitely go to Rona, not me. But again, really critical for us that walking was now seen as a policy priority rather than something that we had to sort of embed by stealth in sport or in physical activity. And then the next slide is I mentioned this earlier, this is the ASOF, the Active Scotland's Outcome Framework. But this is really critical now that government has committed to monitoring progress in, amongst other things, walking and having a stated monitoring framework, which is exactly what this is. All of those three things which I just showed have the links available, so these can be followed up, and I think these will be really key considerations for Nova Scotia as ways that we can start getting that line going up for walking. Okay, on to the next slide. I think I'm into my last 5 minutes, some considerations. So the next slide here shows the ecological framework. You may be familiar with this, but it's to make the point that policy is creates the overarching environment for this to happen, but change has to happen at the macro, micro, social, and individual level as a result of this policy. So it's one thing to write it, but it's really critical to have an implementation plan and understand how it's going to impact. And if you sort of whiz through the animations, the arrows there showing how it cascades down to actually impact individual behavior is really important. The next slide, I think I'm biased, but to recognize the role of research and how that has gone hand in hand with the policy processes. Often in Scotland, we try to write policy that's evidence, if not evidence-based, then at least evidence-informed. And the growth of walking research and the quality of walking research, over that period of time has been really critical to that journey. So if you are looking to to change the policy area in Nova Scotia, engaging with both local and national researchers. You've got some of the world's best physical activity researchers in Canada, I think is a really critical step. And then moving to the next slide, something that has worked really, really well in Scotland has been the relationship between research, policy, and practice. Like I said, in many cases, it's been the same people in post or moving between those spheres over the time. And this has clearly been key to some of our successes. And to give you a reflection, you've got England, which is the south of the border. It's 10 times as big, and they find it much harder to have the same relationships that we have here in Scotland because of the pure size of the place. The next slide, and it's really important to acknowledge some of the global context, which is that as it hasn't just been done in isolation in Scotland, but we've been very fortunate that globally there's been some great progress. Toronto Charter from 2008, the Bangkok Declaration from 2016, the UK CMO guidelines 2011 and 2019, the World Health Organization guidelines along the same timelines, and then the GAPA, the Global Action Plan for Physical Activity, has given us some global legitimacy when we take this stuff to Scottish policymakers to say that this is really worth doing. And then on to my final question that Elaine gave me, why an emphasis on walking? This is probably the thing I'm most passionate about. If you move to the next slide, for me, it all started with a very famous paper called Walking to Health in 1997 by the father of physical activity research, Professor Jeremy Morris, who did the first ever paper on bus conductors, followed up by walkers, post-lofts, and his good colleague, Professor Adrian Harmon. And on the next slide, this is all you need to remember from today's talk, if you remember one thing that they said, and it's been quoted so many times: walking is the nearest thing to perfect exercise. And that has not been disproven or contradicted really in the 25 or so years since they said that, 30 years. Moving forward, a couple of slides. Why am I interested in walking? Well, this is a paper that my colleague Tessa published with myself and Nanette and a couple of collaborators, and it looked at how people in Scotland get their activity. And if you go forward to the key graph from this slide, when we're doing this with teaching or when we're showing this to politicians, we ask them to guess what colours the different physical activities are represented by. We've got it split by men and women. But if you go to the next slide, I'll give you the answers, which is that walking is the brown one there at the top. And crucially, it's the most stable and it's the most equal across age and across gender. So for no other reason than its equitable status, for us, walking is the key physical activity. And you only have to contrast that to sport or exercise and fitness to see that these aren't equitable between men and females, and they aren't equitable by age. But walking is, and for that reason alone, it's the priority activity for population change. Moving forward, and I mentioned this before, the next slide just briefly shows that walking also doesn't just improve your physical health, it improves your mental health. And the same can't be said for many other activities. Walking, it can. So we did this review recently. If you go to the next slide, it just highlights that as well as preventing and treating anxiety and depression, walking improves positive mental health, self-esteem, well-being. There's something in it for people immediately, not just avoiding bad things. They can create good things. There's social benefits. And indeed, that walking in the outdoors, it exposes you to the greenery, the natural environment. And I think that's something that Scotland and Nova Scotia have in common. So walking will improve mental well-being as well as improving physical health, cardiovascular, things like that. Moving forward, and you can whiz through the animations. I mentioned the environmental benefits, air quality, emissions, and again, to emphasize the point, it's equitable and accessible. On to the next slide and whiz through the animations. This is one way to make the argument, which is that walking is not what you're looking at right now. It's not something that's painful. It's in a gym. It's going to create anxiety. You know, walking can be the opposite of this. And if you whiz through the next 2 or 3 slides, walking is not pain. Pain is not weakness leaving the body. If it's not hurting, it's not working. All of these things associated with the fitness industry, which we believe can put people off. You know, Biggest Loser, one of the worst things that's happened for physical activity promotion. You know, that is not what we're trying to get people to do. What we're trying to get them to do is on the next slide, which is go walking with friends, with family in the natural environment. So How can we promote walking? That's the next one. I think we've just got 5 or 6 to go. Professor Charlie Foster did a review and found that mass media, community initiatives, and environmental change have been shown consistently to be the ways that we can promote population-level walking. We go to the next slide. The question was, well, how can we do this if we don't have the budget for infrastructure? Well, there's a few things we can do. And if you just want to whiz through the slides, I'll talk to them as they pop up. We can use economic arguments. And the WHO have built a tool called HEAT that allows you to do economic assessments. If we got 200,000 more people walking, what would be the economic value of that health benefit? And this is a tool that you don't need a PhD in economics to use this, but rather it's designed for anyone to pick up and use. And actually, I was part of the team that built it, so I'm very happy to help. If anyone wants to use the HEAT tool to do economic modelling in your local region, just reach out and we can do that. I don't know if we've moved through the slides. If we just keep whizzing through there. And then, yeah, there's the link to the HEAT tool on the next slide. And the sort of output you get is on the next slide, just showing you the sort of things you can do very quickly to demonstrate the economic rationale for walking. Yeah, and feel free to just keep pushing through them. The next slide shows some case studies where it has been used, including in North America and in the United States. The next one, moving forward, it's really important, we believe, to build an evaluation culture, because that allows you to show that you are delivering, and it allows you to show that it's working and where you're getting the best return on investment. It's working really well in Scotland, and again, something more than happy to speak to you guys about how we can do a pragmatic evaluation in local regions. The next slide. This is really important, but there's so much value to be had from relationship building, being trusted by politicians, not being seen as lobbyists, but being seen as trusted advocates and people that can deliver on something that's for population and social good. Moving forward again, as from Charlie's review, communication, messaging, and social marketing is critical. So on the left there, you've got the CMO guidelines, very boring. In the middle, getting a bit better, infographics. And then finally, moving to the end, campaigns like This Girl Can are really effective ways of communicating to the population who don't want to read scientific papers. On to the next slide, community level action. I'm not going to say anything because Rona's going to talk about this in her presentation, pastoral doing and doing really effectively. And then on to my final slide, the key messages for Nova Scotia is, and then you can just go through it, it's a build slide, but working on the professional culture and those relationships, valuing collaboration, valuing evaluation, understanding that it's not going to happen in 6 months. It's taken Scotland since 1992 at least, but it is worth doing. Getting good at communication, getting good at advocacy, building that evidence base, working with researchers. That includes the surveillance, so you can track if things are working, the value of strategy, and then Nanette added in the last one, play the long game. You know, her whole career has been dedicated to this, and it does take that period of time. So, you know, go in eyes wide open. I'm sorry I can't offer you short-term quick fixes, but hopefully you can see from that whistle-stop tour that it can be achieved in Scotland with joined up working and with building that really good network of practitioners, politicians. So there's the whistle-stop tour. Very happy to take questions if there's any time, or otherwise hand over to Rona or back to Elaine as appropriate. Thank you very much for your attention.
Thank you very much, Paul. Can you hear me okay?
Yep, can hear you there, Elaine.
Okay, so this is the opportunity to ask questions. We certainly have time, and we have an international expert on the phone or on the line there. So does anybody have any questions for Paul? Sally?
Can you elaborate on the right to roam legislation? How that came to be, and tell us a little bit more about it.
So, Paul, the question was, can you elaborate on the right to roam legislation?
I can't, but Rona can.
Thank you. A bit early. Land reform legislation took about 6 years to come through, and it became a law in 2005
although it was enacted by Scottish Parliament at 2003. It came from, we had the Countryside Act, which gave us some rights. It's been called the right to roam. I will slap Paul later for saying that, because it's a right of responsible access. England has a right to roam, which is a very restrictive amount that gets you into only a few areas, whereas the right of responsible access and the right of responsible management for land managers and landowners means that it's two-sided. So all those managing land have to manage for access to allow people to walk, cycle, horse ride where appropriate and responsible. And all those who are taking that access must act responsibly, so not end up in a field full of cows with a dog with you or something particularly silly like that, or wander through crops or anything along those lines. It's said that Scotland has the most progressive access legislation in the world. I'm not sure about that, but it certainly has allowed us to have a lot of conversations with a lot of people to improve the amount of walking and cycling and access to areas, and work with landowners and land managers to make sure that it works properly.
Janet, could you elaborate on the differences in increase in physical activity between urban and rural areas? I wasn't clear on where the biggest change was seen in rural versus urban. Would you do that, Paul?
Yeah, so elaborate on the changes between urban and rural areas. So, do you know anything on this? Okay. So on the slide I showed, I'm just going back to it myself. I'll have a look there, and I'm seeing that Glasgow and Edinburgh had basically 16% increase. Now they are our most urban areas, although that does include, you know, what we call suburbs, and you know, there are some very nice, you know, green ways and green paths in those areas. So I don't know that we could say that's, you know, city only. The biggest increase seems to be in Fife, which is predominantly rural, although it does have many towns and villages. And the smallest was in South Lanarkshire, which would be up there with our most rural, at least south of the Highlands and the Islands. What I'm figuring this out in real time as I'm talking to you, but I'm guessing what we don't have there is the granularity to say, have we really had success, differential success in the most built-up areas versus the suburban versus the rural. What we probably could do is have a look, and that when I mention this to Tessa, because she's so obsessed with understanding the data inside out, she probably will have a look. So what I might request is I'll come back to you with that one in a wee while when we've had a chance to have a look at it. But I don't want to put any pressure on Rona, but maybe you will talk about the difference between interventions and community action and how that might look different in urban and rural areas. So great question. Please let me come back to you.
So Andrea was wondering how much of this process was more iterative versus planned.
Iterative versus planned?
Yes.
Okay, I'm with that want of seeming like I'm not going to ask Rona in on all of them. These are very much someone who's been in the game for much longer than me, so I'm going to pass back to Rona for that question.
Perfect. Rona, we're having trouble hearing you.
Right. I'd love to say that all of it was planned. I think certainly in the first few years it was very much iterative. We were trying different things. Those things that worked, we promoted. The things that didn't work, we told people why we thought they didn't work, and then tried something else. But as things have developed, and certainly once we had the Land Reform Act, and then building towards the walking strategy and the physical activity strategy, that's when much more of it has been a more planned, discussed, and developed path that we've gone on. That's not to say that there's not a lot of invention and iteration happening at the moment too.
Natasha, yes, Paul, can you explain some of the rationale behind the indicator of 10 minutes every 4 weeks?
Yes. So primarily, I've done probably more research than anything else in how to measure physical activity. And one of the great debates is how should we phrase the question. Now, it has been decided by sort of cognitive scientists and people who work in the cognitive validation of questionnaires that the average kind of month or the last 4 weeks is something that people can recall reasonably well. They obviously can recall the last 7 days better, but the problem then is often people have a last 7 days that isn't representative of their general behavior. You know, they might have been on holiday, the weather might have been bad, they might have been ill, etc. So generally speaking, when you ask people to recall over the last 28 days or 4 weeks, you get the best indication of what their stable behaviors, their habitual behaviors look like, with the usual caveats of desirability bias and things like that. Now, the 10 minutes for a while there by the epidemiologists was seen as the minimum bout length to get health benefits. So people, therefore, you'll find 10-minute bouts throughout many of the major questions. But interestingly, that's now gone. As of 2019, that's been removed from the Chief Medical Officer guidelines. I suspect the World Health Organization will follow suit. I don't know what the Canadian guidelines decided. I believe they were released in 2018, and I don't know if they removed their 10-minute bout criteria. The rationale for that was any is good, more is better, and that there was no scientific reason to tie it 10 minutes. So what happens is you end up with these rather obscure seeming questions, 30 minutes in the last whatever, or 10 minutes, and things like this. We just have to work with this as scientists. Say, is it going to be exactly right? Probably not. Is it going to be good enough to give us an indication of who is walking and who isn't? Yes, it probably is. And the final thing to say on that is, from time to time, people are tempted to try and improve their question and change it. Now, that's all well and good if you get an improvement, but if it means that you have to start again tracking your trends and you now can't look at the last 5 years, 10 years, 15 years, you have to ask yourself, is it worthwhile? So happy to give to have a much longer conversation offline about measurement properties and measurement issues, but the short answer is we have to work with what are available.
I have a question about the result that you talked about walking not necessarily having an increase over the older ages, the older demographic. And so I'm curious if you think that top-down approach from policy changes to the individual level is generalizable to all demographics, or is it something that we perhaps consider to start maybe on the individual level with older demographics, work up policy changes, or what your thoughts are?
Did you hear that, Paul?
I've got some pieces. If you could relay, Elaine, that'd be great.
Okay. So the question was notice that the increase in walking for older adults was much smaller than the increase. Well, it was smaller than the increase in walking for young adults, and she wondered if we should be considering a different approach for seniors, looking at rather than a policy environmental approach towards the individuals, starting from the individual and moving up. Did you understand that?
Yeah. Yes, I would agree. I think, as sort of touched on in a different part of the presentation, You know, I don't know if you're able to flick back one slide to the graph that showed the data on older people, or all age groups. You know, 14% increase in the over 65s versus a 21% increase in the under 25s. I would still see that as a success. You know, I think a 14% increase is fantastic, and not one that we would say things aren't working. But the what we don't want to say is, but that's good enough. You know, we don't want to leave these people behind. So one of the ways of viewing that is it's working to some extent, but it's clearly not working as well. What therefore could we do to bolster that, or to add in and to find those individualized or targeted or segmentation type approaches that will help bring older people along with us? At the same time, we've got to recognize that it's not just the walking and the physical activity policy that's having an effect here. There are broader secular trends around people's working lives, working patterns. Rona just mentioned to me things around car ownership, which will be, you know, happening above and beyond what we're trying to do. And we need to recognize that, you know, we're working in a complex and dynamic system where the factors are going to change and other influences are going to be at play. That isn't to say that we wouldn't be looking at that and thinking, how can we at all times help older people to walk more? And do we talk about dementia-friendly walking? Yeah, so a great example of that is something that's happening in Scotland recently, is to try and do more dementia-friendly walking so that people can keep walking and moving around their communities as things such as aging and cognitive decline start to
Did that answer your question? Anybody else? Vicky.
I'm wondering, I guess, have you seen any kind of statistics? You have the graph where the walking goes up. Do you have any kind of correlating statistics of where the health statistics might be going down, or is there anything that may work with that if you looked at the general care?
So Vicky, did you get that?
half of it.
Okay, so Vicky is wondering if there's any data that shows a correlation between the increase in walking and bigger picture health outcomes.
In Scotland.
In Scotland, yeah.
Before I answer, do you know? Not sure.
Yeah.
So, it's an excellent question, and it speaks to the answer or the conversation we had on the previous question. Health in Scotland is changing all the time, and that is impacted by a very long list. The climate, healthcare, primary healthcare services, mental healthcare services, dietary changes in composition of foods, in people using their TVs more, and then people not using TVs and using laptops and smartphones. So physical activity is just one piece of the jigsaw. So what we're not able to do is say physical activity changed by X, and we can now see the effect of that, quantified as Y in diabetes incidence or hospital admissions. It's not possible, and it never would be possible to do kind of monitoring in that way, as much as it is something that would be really, really helpful. What we can, however, do is do very effective epidemiological modeling. What that means is, if we know the risks of smoking, poor diet, alcohol, and physical activity or physical inactivity, and we know the prevalence, i.e. how many people are doing it and how much, we can create statistics such as what's called the population attributable fraction. And I can share this with Elaine for sharing it within your group. There's a very famous paper in The Lancet where they've done this globally. To show we can look at the contribution of walking or the contribution of physical activity to the broader healthcare statistics. And as physical activity levels change, we can see that contribution change in our models, even though we might not necessarily be able to measure it in our hospital admissions. I could keep talking on that, but Elaine, has that addressed the question, or is there a kind of follow-up probe on that?
I think that's good. Thank you.
One question about money.
Question about money.
You mentioned that the active travel budget Is 80 million pounds?
Was the, we're just, Colleen would like to confirm whether the active transportation budget for the country of Scotland was 80 million pounds. Is that right?
So from 40. Yeah, so it was 40 and it got doubled to 80 million, and that's now a 5-year commitment per year.
And that was just in the last couple of years?
Yeah.
Where does that money go? What is that money used for?
How is that money used?
Rona?
Me again. It has a range of purposes. The vast majority goes to an organisation called Sustrans, which is a UK organisation that puts infrastructure on the ground, so cycleways, pathways, other things like that. But a large chunk of it actually comes to Paths for All, and we manage for Transport Scotland, because this has all come through the transport budget, and it's about behaviour change and active travel. So the projects that we're supporting are about getting people to use buses, linking in with school projects, getting projects in communities that encourage people to leave their car behind and take the bus or walk and cycle for short distances. So there's a vast range of things within that programme, which we do have up on our website if you want to see the kind of projects that have been funded. But it's about 56 million goes into infrastructure, and the rest of it is split between a number of organisations around behaviour change and getting people to actually use that infrastructure.
How were you able to get them to double that? What was the major point?
How were you able to get them to double the investment?
Do you want to go, Yul?
A lot of badgering. We have been working on it for a long time, and that's probably the result of about 5 or 6 years of concerted effort to bring transport into the discussion around walking and health and activity. We were all very surprised the day they announced doubling it. We were happy with where we had. We did want more, but we were delighted when they doubled it. But a lot of that is we are very lucky in Scotland in that we have a lot of access to our politicians and to the Scottish Government, the senior politicians. They are all on Twitter. They all want to come out on walks. So we've been doing that, and we keep doing that so they don't forget about what we're doing. And certainly with the climate emergency side of things now, that has really ramped up how they are looking at walking and cycling and public transport going forward.
Our transport minister at the time, Hamza Youssef, had a very good relationship with our public health minister at the time. So that was something that was very helpful, and both were consistently invited to give keynote addresses or to give come and speak at national conferences and national events, and like Rona says, would frequently be seen attending the opening of a new e-bike scheme, or a new cycle access scheme, or a new walking program. So it was that constant relationship and development of that political will that I don't think that's the cause of the doubling, but I think that meant that when there was some space in the Scottish budget, it was seen as something that was well worth spending money on. Yeah, this is so what Rona just said there is something that's really great about walking is that it has cross-party support in Scotland. It's not party political, and there aren't really people speaking out against it. The car lobby isn't hugely happy when we talk about reducing road building, but generally there aren't people saying this is a terrible idea, we shouldn't be doing it.
Any other questions? Okay, so we're going to adjust our agenda a little bit. We were going to have a quick break now for discussion, but are people feeling okay to go on to Rona's presentation? Maybe we'll just get everybody to stand up for a second. is turning very slowly now. No, oh, sorry. I'm no longer. Okay, give your partner a high five. You're slowing down. 10 up and down, 5 times. 5 times now, please. Stretch up. Out to the side. Down to your toes. Oh, excellent. Yay! And grab a drink or a snack if you like. And then we'll get settled in with Rona's presentation. We'll have discussion after.
I put mine up on yours. Oh, go that way. I'll let you.
What slide is it, Rona?
Oh,
Or does she have a different presentation?
different.
Oh, I don't have that one.
Election. Yeah.
I've got it.
But they've got it as PDF.
Did you get it? Try some center seed. Thanks.
Okay. We have something that looks familiar.
All right, you guys. We're gonna get settled. Okay, Josh.
Yeah.
Okay, if everybody could come back into the room, we're going to get ready to hear from Rona. So now we are very fortunate to hear from Rona Gibb. Stop being so happy in the back of the room. There's no laughter allowed.
You must be talking about walking.
That's right. Okay, so we're going to hear from Rona Gibb now. Rona is a manager with Paths for All, and she's been there since February 2003. She's the longest serving member of the organization. She's worked in the environmental sector in Scotland for over 30 years. Started out as a countryside ranger. I don't know what that is, but it sounds lovely.
It's like your national park rangers.
Oh, okay. Thank you. It sounds great. You can't hear me, Andrea? Okay. She has experience in the local authority, public and third sector, including managing a European interpretive planning project across the Highlands and Islands Enterprise area. And as access manager for Argyll and Bute Council. Rona has worked on a number of occasions with the British Council in Brazil, training interpretive planners. She was seconded from Paths for All into the Scottish Government for 14 months to help write the National Walking Strategy, and now facilitates its delivery forum. Rona sits on the National Access Forum and is a voluntary trustee, board member of Cycling Scotland and Green Space Scotland. So without further ado, Rona Gibb.
Hello again, formally, instead of nipping in at the back of Paul. Hopefully you can all hear me okay. Yes? Can everybody hear me okay? Can you wave at the back if you can hear me? Yay, good. Right. Yes, I'm delighted to be able to speak to you. I have been around for a long time, wearing different hats in the environment sector in Scotland. What I'm going to do is take you through a whistle-stop tour of the sorts of things that as an organisation Paths for All has done over the last few years. Elaine asked me to look at some of the examples of what we've done and talk a little bit about how we've approached things. So if you move on to the next slide. This is who we are. That's some of our happy bunch. We have 32 members of staff, which are about 26 full-time equivalents who cover the whole of Scotland and cover different aspects of the work that we look at. My role as one of the managers is to manage the active environments team, which is about infrastructure for paths and bridges, our communications team, and also our policy team. And as Elaine mentioned, I lead on the National Walking Strategy. So we all have different roles within the organisation. If you go to the next slide, please. This is our strategy. It's about what we want to do is create a happier, healthy Scotland where physical activity improves quality of life and well-being. And we have added in the well-being bit recently, and I'll talk to you a bit about that. Our strapline and focus is everyone, every day, everywhere. And it is about trying to get everybody out walking as much as possible. However, I will say that our remit as an organisation, and we are a charity, our charitable purpose is also about the wider aspects of access. So it is cycling, horse riding, it is about getting everybody out, and that links back to our work through the Land Reform Act, which is much wider than just walking. And the four themes that we split our work into is walking for health, active environments, active travel, which is around the link to public transport, and communications and policy links across all of those. Next slide, please. So these pictures, it is about everyone. It's about all ages, all abilities, all nationalities, all religious, whatever, it's everybody. How can we get everybody out there? Next slide, please. It is about every day, so it's about getting to work, it's about getting to school, it's about taking the baby for a walk, it's about taking the granny for a walk, it's about taking the dog for a walk. It's wherever you need to go, can you walk? Next one, please. And it is everywhere. Most of our focus, I have to say, is on lower level ground. We don't do so much on the high mountain type areas. We do work with organisations and partners who tend to spend more time there, and we do have some involvement, but most of what we are talking about is from people's front door out, around their local environment and their day-to-day lives. Next slide, please. This goes back a wee bit to what Paul's already covered, but we have a vast range of community sizes, everything from very small to Glasgow, which is the largest city with over 600,000 people. Edinburgh is just over 500,000. But many of our communities are in the low 20s, 30,000 or smaller. So I think from what I've read up that that's fairly similar to areas within Nova Scotia. Next slide, please. Paul touched on some of the policy areas, and that's one of the biggest changes in the last few years, that we as an organisation have had a much stronger focus on policy influencing. And as I said, I manage the policy team, which is one other person and me, but actually everybody in the organisation gets involved to a certain extent as well. And the policy areas that we cover are wide, so it's health, it's transport, it's planning, it's town planning, it's isolation, it's a whole range of things. Next slide, please. And also one of the things, particularly around the walking strategy and now the work that we all do, is about putting it in the national context. For our politicians, both at national level and also at our local and regional level, it's really important for them to see how walking fits in and delivers on what they're being told or asked to deliver. We've spent a lot of time making the case for walking. The flower diagram that you can see there is our national performance framework that the Scottish Government works to, and it has all these different petals or different areas of work. Under that, we then have the Active Scotland Outcomes Framework, which Paul mentioned. We have, and the associated delivery plan. We have our public health priorities and the long-term vision for Active Scotland, amongst a myriad of other policy areas. One of the things that has said about Scotland is that we have a fantastic policy picture. Where we sometimes struggle is about getting that policy into practice. But we're certainly not short on policy for most areas. Next slide, please. Paul touched on this. This is the Active Scotland Outcomes Framework. On the Scottish Government website, when you click on each of these coloured boxes, it takes you into the national statistics, the most up-to-date ones for each of those areas, which has been a really useful tool for us because we can send people to that to have a look. Next slide, please. The National Walking Strategy has been a large part of my life for the last few years. But it is about getting people out, and it's about having good environments for them to be out there in. And it is about designing places to encourage walking. And I actually spend most of my time these days not talking about health, a bit around transport, but actually a lot around urban planning and design of urban areas and community areas. And that can be small towns as well as big cities. But it is we have designed out the opportunity for physical activity in many communities and towns and cities because the car is king. And it's now about reversing that and trying to get people out of their cars and being more active. But that is going to take quite a bit of work, and that involves a lot of different policy areas and planners to help with that. Next slide, please. We have the action plan that goes with the National Walking Strategy. That's just been revised. The partner organisations, those are the organisations that sit round the table on a quarterly basis, looking at how we're doing with the actions. It's taken us about 3 years to develop that forum to the point that we're at now, and we're looking forward with the new revised action plan to having a much better process of recording what's actually happening. Unlike cycling and some other activities, walking is actually quite difficult to measure in the sense of what activity is happening. In the sense of Paul's research, it's a bit easier, but in terms of actually day-to-day, how many people are walking, where are they walking, what are they doing, it's trickier to do. So we've got a lot of actions and a lot of partners that we now need to make sure are recording that. Next slide, please. This is one of the diagrams that's within the walking strategy, and it was one that I did very early on, and it harks back to work I did when I was in a local authority area in Argyll and Bute as the access manager. And for 2 years, I played a game with our local elected members and said, give me a topic that I can't link walking to or a path. And in 2 years, they didn't manage it. And it is really important when you're looking at walking to think about all the different areas that it impacts on. And that's been one of the strongest things that we've done with our politicians and others to try and make the case that it's not about putting on a nice woolly hat and going out for a nice wee walk at the weekend. It's actually a fundamental part of day-to-day life and people's health, well-being and transport that we need to build walking into everything that we do. So whether it's about a new housing development, whether it's about early years, so that's around children under 5, how can we get them more active? It's about getting children to walk to school rather than being driven every day. It's all those kind of areas, but we have spent a long time stressing the fact that walking impacts on pretty much every area of Scottish Government and local government work. And it may be that it can help deliver, but it also is that it brings added benefits. Next slide, please. So the infographic that you can see there is the one that we have for the walking strategy. And we did this 2 years ago. Community is the only thing that's not got a bubble, but that's because it covers all of those areas. And those bubble areas are the chapters within the action plan for the walking strategy. But it's been very useful to be able to hand that little picture to whoever we're talking to and say, this is what it's about. These are the areas it impacts on, rather than having to have them sit down and listen to me or somebody else for a long time. So it is about community-based, it is about empowerment of communities, and it is a lot about getting volunteers and harnessing the support of volunteers, which is a lot of what we do. And it's about better quality environments. Next slide, please. This is about as technical as I'm getting on the graph front. You've had Paul's graphs, but all that we are talking about is increasing people's activity and highlighting the benefits and getting the stories back about the benefits that people are getting, and then using those stories to help with the arguments that we're making elsewhere. Next slide, please. So where to start? This little group of pictures, I think, covers it quite well. You've got to have some aspiration in the first place, and I'm sure all of you have plenty of that and are doing amazing things already. You've got to have inspiration, you've got to have a lot of motivation, and you've got to be prepared to put the perspiration in. Much of what we have done in Paths for All as a charity is being able to respond quickly to opportunities that have come up. And that's where a lot of our government agencies are not able to react at the speed that we can potentially act in. So we've been able to try things, to test things, ahead of them potentially taking it on and moving it forward. Next slide, please. We talk about 3 aspects of health. So we've got the physical health, so the getting the people out there. All the pictures you're going to see are from our Health Walks programme, and I'll talk a little bit more about that in a minute. And the quotes are from these people that you're seeing. So this lady started walking. She was having trouble with pain in her knees. Over a period of time, she's found it much easier and has carried on walking. Next slide, please. We talk about mental health, which Paul talked about. This lady, Debbie, started off having been to her doctor with quite serious depression. was encouraged to join a local health walk. She did that, and she's now become one of the walk leaders over the period of a couple of years, and is one of the best advocates for walking and your mental health that you could ever meet. Next slide, please. But we also talk a lot about social health. The physical impacts, the mental impacts are all there, but actually getting people together out of their house and getting them back into social areas. Much of our health walk is with older people. Many of them suffer from social isolation and loneliness. A lot of our health walk data has been fed into Scotland's new social isolation and loneliness strategy. And it is about getting people out and talking and being part of the community again. Now, some people don't want to do that in big groups. Some people like the idea of a big group. The great thing about most of our health walks is they end up in a coffee shop. So they like the idea of getting out, having a coffee and a bit of cake and a bit of chat. So that's why we talk about physical, mental and social health. Next slide, please. So the different areas that we work in, and we work across a wide range. We work in health and care settings, so that can be old people's homes, it can be around social groups. We have strength and balance. We added this in with work that we did with one of the universities in Scotland. So it's not just about people getting out and moving. We actually need to be careful on how they're getting out and moving. So it's about increasing their strength and their balance. And over time, with the walking and the exercises that we suggest, that's about reducing falls and reducing opportunities for trips as well. Walking football was an area that we moved into 5 years ago. We brought walking football into Scotland. It had started in England and was growing quite quickly, and we thought it would be something that we'd like to do. With many of our health walks, the vast majority of the people coming on them were ladies over 60, and we didn't have many gentlemen over 60. And although we weren't wanting to start a dating service, we did want to encourage more older men to be a bit more active. So as many of you probably know, football or soccer is a big thing in Scotland. We're often not very good at it if you look at the international stage, but you know, but many older men have played football in their youth and then have stopped for whatever reason and then don't feel that they can go back into it. So walking football has gone from strength to strength. We started off with 2 groups. We've now handed it back to the Scottish Football Association because it's really their thing now, and we've let them get on with it. But I think there are now something like 150 walking football events every week around Scotland. There's a national tournament, and they recently came second in the World Walking Football Tournament. So it has really taken off, and there are now women's teams as well, and heaven forbid there's even some mixed teams. There's a whole range of things there. Dementia-friendly walking I'll touch on, cancer-friendly walking, and a national engagement campaign is a range of things that we do. Next slide, please. So our Walking for Health and Community projects is the biggest area that we have. We've trained over 11,000 volunteer walk leaders in the last 10 years. We have a training program that covers a whole range of things, but it does mean that there is confidence at the end of it that people are able to lead a walk safely. We provide a range and package of training and resources at the back of that, and all this information you can get off our website. We've worked very hard to get to all different communities, and we do work in all 32 local authority areas within Scotland. So there isn't an area that we're not working in. And at the moment, in the vast majority of Scotland, nobody is more than 2 kilometres from the start of a health walk. So there's a lot of work going on. Next slide, please. On our website, we have a Find the Health Walk map. It's an interactive map which has been developed over a few years. It started off pretty much as a hand-drawn one with some dots on it, but now you can interrogate it and you can put in where you live. It will tell you where the nearest health walk is, what time it starts, where it starts, and who the contact is for it. So that is giving all the health walks across Scotland the opportunity to encourage people to use them, and also we're encouraging visitors and tourists who want to join in too, that they can go onto this and see what's around in the area that they are. Next slide, please. So the health walks are regular, they're volunteer-led, they're free, and they're less than an hour long. A lot of them are around about half an hour, and they're not particularly strenuous, so they're usually all on the level. We have 670 weekly walks across Scotland, delivered by 200 projects, and that grows every year. The walks are open to everyone, but some of them cater for specific groups and conditions, so that's where I'll talk about the dementia-friendly and the cancer ones in a minute. And we manage and provide support, but we don't organise all of this. So for each of the local authority areas, there's usually a coordinator post, which through a grant process we support many of them, but a lot of them are supported by the local authority or the local health board, or a number of partners that have got together to provide the funding for that post. And they are the ones that recruit the volunteers locally, that sort the walks out locally. We're the umbrella national organisation, if you like, that helps them with insurance, with training and with resources to support their volunteers. Next slide, please. So we've looked into different aspects. Dementia-friendly walking is one of the newest areas that we have, and we've been doing this for a couple of years now. We work with a national organisation who focuses on improving people's lives with dementia or Alzheimer's. And what we have found is that that is an area that is growing considerably in Scotland, with a number of people who are being diagnosed with Alzheimer's or dementia. And I think that's a worldwide problem as well. But it's about how do we make our walks more user-friendly for those people and for their carers. So we've put together a programme of additional training for the walk leaders. They get accredited, so the walks are accredited then, so people know that they can go to that. And we've been working with health professionals and others to develop all the aspects that we do with that. Next slide, please. We've looked at workplace walking. Over the last few years, I have spent a considerable amount of time sitting on my backside talking about walking and not doing it. Over the last year, I've had a concerted effort to lose a lot of weight. To date, I've lost about 60 pounds, which means I'm feeling colder in the winter. I don't have as much natural insulation around me. But it does mean that I have a better idea when talking to people who are sitting in front of their computers about what they should be doing. So our workplace programme came out of our community walking area, and it was about how do we get employers, how do we get people at work to be a bit more active. So it's using the toilet on the floor downstairs, it's using the photocopier at the far end of the office, it's going for walking meetings, it's trying to be as mobile as you can during the day. So we've started a training programme, we've had that running for a while, and over the last 8 years we've had a national pedometer challenge directly to workplaces in teams of 5 to try and get as many steps as you can. So this was the summer one, that we're just finishing our autumn one, our autumn one, I think we have 300 teams I think involved, and teams of 5, and it's growing all the time. Next slide, please. So walking football I touched on earlier. We also now have walking rugby, walking netball. There's a whole host of walking sport type things, which is about encouraging either older people back into the sport they liked before, or it's about people who have had some kind of injury, giving them the opportunity to take up something a bit more active again, but not as full-on and active as the full-blown sport. The 3 pictures at the bottom there goes back to what Paul mentioned about political support. The gentleman on the left-hand side in the bright pink shirt is our current Minister for Health and Sport and Physical Activity. The one in the middle was our previous one, who's now the Cabinet Secretary for Communities. He's a very keen footballer and goes to all our local matches. And then on the right-hand side, the gentleman on the left with the yellow socks was our previous Minister for Wellbeing and Sport, who's now our Workplace and Employment Minister. And the one in red is the Hamza Yousaf, who Paul mentioned earlier, who was our Transport Minister, is now the Cabinet Secretary for Justice. We tap into all the things they like doing, basically. They're all keen on football or some kind of sport, and we try and get them linked in. And the walking football really has been a way that they have all got involved. In fact, we've also had a walking football challenge in the Scottish Parliament between the politicians of various colours to get them a bit more active. So we will try anything and do anything to get walking into their day. Next slide, please. We've also worked a lot with health professionals, and that's taken quite a long time. There has been a reluctance from doctors and others to push out their patients to untried areas, if you like. So we have had to work very hard over the years. We've started managing to find doctors who are keen to do it, who try it, and then we use that case study and move it forward. But we've also worked with the allied health professionals, so the occupational therapists and others, to increase their awareness so that they can then help get people onto the walking groups that are in their local areas. We've also done a lot through social prescribing. So again, that's a growing area within Scotland where doctors are looking for other places rather than through pills to get people moving. Next slide, please. I mentioned care settings and old people's homes. So again, training staff there to get people more mobile. The strength and balance exercises are, some of those are there on the left-hand side. So it's about strengthening ankle, knee joints, hip joints, moving. We have a set of exercises that can be done standing or sitting, depending on how the person feels. And then it's about encouraging the care staff to get people out on a much more regular basis. And this has been within a programme that Scottish Government set up, looking at wider care home settings and how to increase physical activity. Next slide, please. The cancer-friendly walking, we've worked with our national cancer, or one of the national cancer charities, Macmillan. We have had an officer embedded within their work. So it is about encouraging people who are living with cancer, or those who are living with somebody with cancer, to be able to be a bit more active. Some people are very keen to go to the regular health walks, but others feel more comfortable about being in a group where other people know what they're going through and they're able to talk more freely. So there's an opportunity for them to do both. But that's been a very, very successful programme over the last 3 years. Next slide, please. We also work within education, although not us directly. And again, this is where it comes back to partnership working. We work with a wide range of partners, and we are a partnership organisation. So where other partners have a particular area that they work in, we don't necessarily go into that. So we support Living Streets and Sustrans and others to do walking with schools and school-age children. And where we can help, we do, but we leave them to that area. The Daily Mile, I'm not sure, is that something that's come to Canada? The Daily Mile in schools? Yes. Not yet. It's slowly taking over the world. It was started in a school in Stirling, and it's about 15 minutes of activity for children every day at whatever time the teacher decides to do it. And the research at the back of it has shown fairly significant changes in concentration and ability to do their work. So again, it's something that we've helped with where we can. Next slide, please. We've also tried where possible to mainstream the activities. So many of the projects that we've supported initially through grants, we have worked with them so that the local authority or the health board or others take them on a full-time basis. So it's not a short-term thing, it's a much longer-term thing that and program that they have available to them. Next slide, please. We also look at all sorts of different ways of engaging with people. So whether it's through social media, whether it's through project resources, partnership events, national campaigns, we do whatever we can, wherever we can, with whoever we can. We're not worried about who we work with as long as it's about promoting walking. Next slide, please. And one of the big things is about celebrating success and making a lot of noise about it. And I know many of you are doing lots of similar projects, but my experience over the years is that you've got to get the local press involved, you've got to get your local politician involved, you've got to get whoever you can involved and celebrate that success, however small, and promote what you're doing. We hold our annual volunteer awards in the Scottish Parliament with the Minister giving out the prizes, and that has been very popular and gets us a good bit of press coverage as well. Next slide, please. So some of the examples, I'll rattle through some of these. Next slide, we've got our step count challenge. So that's our walk at work program. That's tricky. We've developed the online platform and various other things throughout the time. Next slide, please. We have done research, and this is with some of Paul's colleagues. One of the things I would say to you is that there is a massive amount of research and information and data on walking out there. But politicians, doctors all want that research. So I would look around for what's already out there in the world, but also think about some very local stuff too, so that you can show the impact you're having. So this was on one of the early workplace challenges, and we were showing an increase in the number of people who were using walking as part of their way to work, but also under leisure, and they were sitting less during the week, which was a major thing. Next slide, please. Buggy walks, about getting young mums who are often isolated, having had a baby, and find that they're maybe no longer going, they're not going to work anymore for a while. They suddenly don't have a group around them. So getting young mums out. We did a couple of projects with health visitors or local nurses who actually went on the walk with the mums. And they actually found that they got much more information about what was going on with them than they ever did in sitting across the table at them asking them questions. And we find that a lot with walking meetings. Next slide, please. Beat the Street is a programme that an organisation called Intelligent Health has done across the UK. And the boxes that you can see the little girl jumping up to and the granddad and his granddaughter bending down to are electronic tap machines that you have a card, you tap, and they're put up around the town for several weeks. And it has significantly increased the number of people getting out and about. But also what we've found is that it's also got an intergenerational aspect, with older people wanting to do it as much as the younger people, and it getting quite competitive as well. It is quite expensive for the boxes, but it has proved to be very, it's worked very well. And once you have them, you can move them around into different areas. Next slide, please. That's just some of the other stats around this. The populations that for this particular project were 9,000 in one town and 4,200 in others, so not big communities. And they've found a significant take-up and getting out there, so 90% feeling more involved. And for both those communities, I think it was over 70% of the population actually took part, which was astounding. Next slide, please. We work with our national parks, not quite on the scale of your national parks, but they do have walking projects, and there is a link to videos on a couple of these slides, which I suggest you have a look at. It gives you a lot more detail and talks more about how people have felt on these. But definitely building community cohesion, getting people out and about. Next slide, please. Also working with different cultures. So this was a Nepalese community in Aberdeen, who again didn't really go out out and about very much because they weren't sure where they could go. So working with the Health Walk group, they started their own group, and it's been amazing. They're out and about all the time now. They have outings, they have picnics, they have social events, and bringing in the wider community as well. So focusing in on some of the more difficult or more challenging communities to get hold of. Next slide, please. Oh, buggy walks I've put in twice. Next one, please. The buddy walking was about one-to-one walking. So that's about where people don't want or don't feel comfortable about being in a group, and where there's an opportunity for them to get to know one person, and for that person to maybe go once or twice a week and go out for a short walk with them, and eventually encourage them to join in with the other groups. And that's been, through some of the mental health projects we've worked with, been very successful. Next slide, please. We set up the Scottish Health Walk Network, which is about giving all these projects the opportunity to network. And we've been doing this informally for a while, but we're doing it much more formally now. Next slide, please. And it's about giving them resources, but it's also an opportunity for them to talk together. Next slide, please. I'm aware of time, I'm going to rattle through. We've had great support from our Chief Medical Officer in Scotland, Catherine Calderwood, who's been out on walks and also helped us launch the network. So again, it's that political senior official support that we've tried to engender all the way through. Next slide, please. I'll let you read that at your leisure later on, but that's all the sort of things that we provide. So it's training, it's accreditation, it's public liability insurance, it's volunteer awards, it's access to a lot of our resources. Next slide, please. I mentioned earlier that most people are close to a health walk. A lot of the walks start within or near green space, and 57% of our current walkers, we do a survey of new walkers, and then 6 months in, have reported a change in their long-term condition. So it is about measuring and showing what the benefits and the increases are. Next slide, please. So 37% of walkers are active initially, and after 6 months, they report that about 84% are much more active than they were. And the bottom one, as a result of attending health walks, 70% of the walkers say that they walk more for short journeys rather than taking the car. So again, that's the multiple benefit, and not just on the health, but into the transport and climate aspect too. Next slide, please. We've said before, there's a lot of information around, and one of the things that we're trying now not to do so much is keep proving that walking works. We know it works. There's lots of people know it works, and it's about using that information better. It's about engaging health professionals and others, town planners and transport officials and others too, and it's about building capacity locally. So that's where the volunteer network is essential to what we do. Next slide, please. And we work, as I said, we work with everybody, but it's leisure trusts, it's National Health Service staff, it's charity, third sector people, it's our local authority, regional councillors, it's volunteer groups, it's others, it's everybody. And I think that's one of the things that is our strength. We will work with anybody who wants to promote walking and promote the benefits of walking. Next slide, please. You're nearly there, I promise. It is about painting a local picture, so that's where, as a national organisation, we can't do that. It's about those people on the ground making the case locally and using the local examples and us helping with the training support resources. Next slide, please. I'll skip over these, but these are the different aspects that we provide. So we've got training, the next slide. And we provide a set of resources. So we deliver annual events, we link to national campaigns. We have considerable amount of communication stuff that we do, and that's been a focus, particularly in the last 3 years, that we do a lot more of now across a whole number of channels. Next slide, please. We do an annual campaign which is called Big Fit Walk, and that's about trying to get anybody who wants to organise a group to get out for a walk during June. And they can let us know it's happening, and then they can put their dot on our website map. So we every year get more and more groups, and that can be from school groups to church groups to workplaces, anybody and everybody who wants to get out there. Next slide, please. We also have an online resource which used to be a great big thick tome of paper, but we've now put it online, which is all the data that we think we have on walking in one place. So the Scottish stats all in one place, so it's called Walkipedia, and the website link is there if you want to have a look. Next slide, please. One of the big things that we do is use the examples from the walking groups and the quotes from the walking groups for our politicians in our press, because it's much more effective to have the words of somebody who's actually living it than some professional or politician. So I would encourage you all to track and to keep all these different quotes from the people that you're working with and use them accordingly. Next slide, please. And these next two slides, we've developed infographics for different areas. So whether it's about getting people out and reducing the risk of depression, next slide, please. About reducing different conditions, so diabetes, about boosting your mood. We use these a lot in Twitter, our Facebook side of things. Next slide, please. Using dogs, getting your dog out for a walk is a good way of getting people out. So we do a fair bit around dog walking as well. Next slide, please. And if none of that has convinced you yet, the walking is a good thing, and there's lots of things you can do. If you haven't already watched Mike Evans' TED Talk or YouTube on 23.5 hours around walking and health, I suggest you do. And if you want to encourage anybody else to do it, get them to watch it as well. I think we're at the last slide. Yep, that's me. So apologies, I've run over. But those are the different ways that you can get to us on our Facebook, our 3 Twitter channels. The Step Change Scotland is the National Walking Strategy Twitter feed, which we use on a daily basis, and then our website, which has most of this information on it. So thank you for your patience.
Thanks very much, Rona. That was awesome. Really interesting. Does anybody have any questions for Rona?
What do things look like this time of year, where there's so much darkness and the weather side of winter coming and stuff? Is there any special programming that happens for people to get out and just, take in the different conditions in the darkness versus?
Did you hear that?
I've got a bit of that. Was that around what do we do with the darkness and encouraging people out?
Yes. How do you manage when the weather isn't as nice to encourage people to walk?
We suggest that everybody's waterproof. You're not going to shrink. And we do all our health walks run throughout the year. And certainly with things like the Daily Mile in schools, that is running all through the year. So the teacher chooses the time to go out hopefully if it stopped raining for a bit. We do give some advice around if you're walking when it's darker to potentially have brighter colours on, to make sure that you carry a torch if you're going out with street lights. We have done a survey recently that did suggest, which has been a consistent thing for a while, that women in particular are less likely to walk in dark areas, and particularly where street lighting is particularly poor. So it's about encouraging the kind of walking with a friend, going out for a walk with a friend, finding somebody else to walk with. We try a range of things. It is difficult. Some people do like going out, others don't. A big issue too is the state of the footpaths, the pavements, the walkways, and trying to encourage our local authorities and transport authorities to clear snow and ice from them and keep them clear as much as they do for cars. It's probably as important, if not more important, to stop a lot of the accidents and slips and falls. So there's no magic bullet there, but we do try and encourage. We have had some projects though who have used the local shopping centre, particularly for older people. So I think you would call them shopping malls, and actually doing loops within the shopping mall with the walkers who don't want to be out in the cold and the snow. So there's always a way to find an opportunity to get people walking.
Does somebody else have a question? I thought I saw another hand earlier. No other questions for Rona? Okay.
I'm getting away lightly.
Yeah.
Or I answered all the polls earlier.
Yeah.
I would like to know about your training and how that works, and how long is your time is it training? Is it themselves? Is it free? Some of the details.
Can you tell us more about your walking leader training and the details around cost and training in general?
Okay, our training program, we've got a manual and everything that's all there that we work through. It's a day-long course. If we are already grant funding a project, they get that training free, but we do it for other organisations where we charge, sometimes depending on who the organisation is, we will charge up £500 for the day, which again is quite cheap in the scheme of things. But for other organisations, it might be that we ask them to provide the venue and the lunch, and we provide the trainer. So it depends on who we're working with. If we think the organisation can afford it, we charge them. But certainly for our grant-funded programmes that we're working for in our community groups, then it's free through the grant process. There are different elements of the training. The initial training, as I say, is a day, and then we have other training involved. Again, if you want to have a look on our website, there is some information on that there, but it's something that we've developed over quite a number of years. It basically takes people through how to organise the walk, how to look out for any issues, the risk management of looking at the walk first before you take people there, all those different aspects.
Does that answer your question? Oh, okay. Yes, Vicki?
I caught the statistic where you said 85% of the population lives within 2 kilometers of a health walk. That's a very different setup than where we are. How do you reach out to those people in the rural area, or is there involvement there at all, or is it hard to reach them?
No, there's quite a significant involvement in the rural communities, and we have health walks running in every local authority area. So right up in the Highlands, out in the islands, there are walks running. They tend to be a slightly different format because they're not necessarily walking around a kind of urban park or something like that. They're maybe a bit more rugged. but they're still encouraging people out. Our smallest communities have health walks in them, and I think the 85%, the vast majority of that will be in Central Belt and around the big cities and our bigger communities. But many of our smaller communities have them as well. So I can hand on heart say that we are rural as well as urban, but the vast majority of what we do is urban.
Janet?
We're always looking for opportunities though to get more of the rural communities active.
So I was wondering, on the ground in the local communities, what particular partners, whether it's a nonprofit organization or a library or whatever it might be, what kinds of groups are you working with who are actually, running the walks on the ground?
It's actually a really wide range. We do have some that start from libraries, and it's the library that organises them. There's a couple in Glasgow that do that. Most of our partners that we're working with are either health related or community, some kind of community group, whether it's through a community council or something like that. We have a number of national organisations who get involved too, but mostly it's through the health link locally. But that kind of started from a conversation with a nurse or a link to a doctor, or it can be somebody who has been to a physiotherapist who's had a bit of a conversation and they've then wanted to do something more and come to us. There is no one size fits all with any of this. We're now working more with sports centres, so the sports staff are trained, and again that's about trying to move people on through activity and give them opportunity to try things. But for many people, walking into a sports centre is just the last thing on earth that they want to do and would ever think about doing. But by encouraging the walking aspect, then hopefully they can see that there might be some other things that they might want to try as they feel a bit more confident and a bit fitter.
Thank you. Anybody else have any questions? Darth Vader joined you? Other questions? Then we'll move on to our discussion period. But before we do that, Rona, and is your colleague still there?
Yeah, Paul's still here.
Very nice. So
We're sitting in his office.
I'm just going to move so you can see me. There we go. Well, we just wanted to thank you very much for your time. I think that probably everybody in the room learned something of value, and I certainly found it very, very interesting. There are so many similarities between Scotland and New Scotland, we're going to move on to some great conversation about what are the potential implications in Nova Scotia. So thank you so much. It's been a pleasure.
Well, thank you, and I think I can speak for Paul to say that I think I can speak for Paul as well, and if there are other things that you'd like to follow up, then please do with us, and if we don't know, hopefully we'll find somebody who does.
Awesome. Thank you.
Bye.
Okay, I'm going to hand it over to Anna for the next part of it. We're just going to do kind of the first question, we're going to popcorn style, so if something comes to your mind, just so